All right, so something big is happening in real time, and it starts with a language change. The Department of Health and Human Services is rolling out a very specific framing. What most major medical groups have called gender-affirming care, HHS is now officially calling sex-rejecting procedures. That exact phrase shows up in their press releases and in the title of a proposed CMS rule aimed at hospitals that treat trans youth. You don't have to agree with every medical guideline to see that this kind of rebranding matters. Language isn't just describing policy, it's steering the room, telling you in advance what you're supposed to feel about the people affected by it. Here's the question this video is really about. You can be cautious, you can be skeptical, you can say, I don't think minors should have access to medical transition. And you can point out that some countries have tightened youth protocols or shifted toward more conservative treatment pathways. That debate exists, and it's happening in multiple places. But if your answer is no to medical care, especially for young people, what's your answer instead? Because instead cannot be fine, no medical care, and also you don't get to exist socially either. If the argument is kids are too young to make permanent decisions, then set the medical debate aside for a second and look at the kid in front of you. What do you do with a child who's saying over and over for months, for years, sometimes for a lifetime, I don't feel right in my skin, I don't feel safe, I don't feel seen, I'm miserable? For some kids that distress eases as they figure themselves out. For others, it doesn't go anywhere, it just gets pushed underground. Either way, do nothing and forbid everything isn't care, it's abandonment. If the policy answer becomes no treatment, no support, no social transition, no name, no pronouns, no clothes, no hair, no space, then what you're demanding isn't caution, you're demanding submission. When adults respond to a young person's identity with blanket rejection instead of basic accommodations, the outcomes aren't mysterious. Studies show transgender and non-binary youth face dramatically higher rates of depression, anxiety, and suicidality than their cisgender peers, and that's a major driver of that risk in victimization, rejection, and hostile environments. Environments that are more accepting, families, schools, communities that let them exist without constant punishment, are consistently associated with lower suicide risk. On a very practical level, something as small as pronoun respect shows up in the data. In large surveys of LGBTQ youth, those whose pronouns are respected by the people around them attempt suicide at significantly lower rates than those whose pronouns are ignored or mocked. That doesn't mean pronouns are magic, it means contempt is poison. So if your politics or your worldview lands on, I don't want you to medically transition, and I also don't want you to socially transition, then the only remaining option you're leaving that young person is suffer quietly or disappear. You might not like hearing it put that bluntly, but that's where the math lands when you remove every avenue of support. This is where a lot of the conversation gets deliberately blurred. Social transition, names, clothes, hair, pronouns, how someone presents, is not surgery. It's not a prescription pad, it's not a scalpel. Social transition is reversible in a way that puberty, time, and bone structure are not, and it uses the same tools everyone else uses to signal who they are every single day. If someone says, I'm worried about medical risk, but then turns around and tries to police a teenager's haircut, punishes a kid for asking to be called a different name, or bans any acknowledgement of their identity at school or at home, that's not concern, that's control. And it's revealing because it means the discomfort isn't just about medicine, right? It's about visibility. It's about not wanting gender nonconformity to exist in public life at all. The goal becomes shove it back into closets, make it invisible so you never have to think about it. So here's the plain question. If you think minors shouldn't access medical interventions, okay, what do you believe they should get? Because a defensible answer has to include dignity, safety, room to breathe, and adults who don't turn their very existence into a courtroom drama every single day. Anything less isn't neutral, it's punishment. A lot of people push back with, well, I'm not trying to be cruel. So here's a gut check. Do you treat that child's identity like a debate topic or like a person? Do you talk about them like they're a danger or like they're a kid? Do you hear a name request as ideology or as this is how I'm trying to survive my own life? Nobody's saying every adult has to instantly grasp every nuance of gender theory. Most people are learning as they go. Most people are clumsy at first. Clumsy is, I'm trying, I mess up, I correct myself. Cruel is, I will not grant you even the smallest courtesy and I'll laugh at you for asking. When an adult refuses every small kindness, every reversible accommodation, and rallies policy around that refusal, that's not cautious parenting or careful public health. That's bullying with a policy wrapper. Another move that keeps popping up is, well, it's a mental disorder, said like a permission slip to be cruel. But being transgender is not, by itself, a mental disorder. The current diagnostic manuals explicitly separate identity from illness. Gender nonconformity is not a disorder, and the diagnosis of gender dysphoria is about clinically significant distress because distress is what gets treated. The point is to reduce suffering, not to erase an identity. And even if something involves the mind, just turn it off. It's not a treatment plan. Telling someone with intense, persistent dysphoria to just stop feeling that way works about as well as telling someone with anxiety to just relax, or someone with OCD to just stop thinking about that. People don't work like light switches. What keeps showing up underneath the clinical language is something much simpler. Erase it, hide it, make it invisible, stop being weird in public. That's not medicine. That's discomfort with difference dressed up in diagnostic vocabulary. Gender diversity isn't a brand new internet trend. Cultures across history have had more than one way of living gender, from recognized third gender roles to social spaces for people who didn't fit the binary norms of their time. What's new right now is the sheer volume of attention and the American panic that treats any visible deviation from rigid gender rules as a moral emergency. There's always been backlash when people who are supposed to stay invisible step into public life. The pattern, marginalized group becomes more visible, dominant group calls it a threat, policies get written to push them back down, has a history too. So when someone says, "You're sick, get over it," what they're really saying is, "Your existence makes me uncomfortable and I want that problem to go away." That's not science. That's not concern. That's cruelty with vocabulary. You can argue about medicine, you can argue about guidelines, ages, evidence standards, and international differences in how care is delivered. Those are real debates. But if your solution requires humiliation as a feature, not a bug, if it depends on making a kid's life so uncomfortable that they stop asking to be seen, then you're not protecting children. You're disciplining the ones who don't fit your comfort zone. That's not morality, that's fear dressed up as principle. So here's the question to sit with, especially for people who oppose medical gender transition for minors. In real life, day to day, what do you owe those kids socially? Basic decency looks like using the names and pronouns they ask for, even if you're still wrapping your head around it, because the data says that simple respect is linked to lower suicide attempts. Protecting them from bullying instead of joining the pile on, knowing that interpersonal rejection and school hostility are key risk factors for suicidality. Giving them space to explore clothes, hair, and presentation without punishment, understanding that these are reversible expressions, not surgeries, and for many youth, they're lifelines. If you're not willing to offer even that much, then the issue isn't safety or science. The issue is that someone else's existence breaks your script for the world, and you're choosing to protect the script instead of the kid. See you next time.